explain the health check report? Because that's the one that's got everybody confused. The words say, no problem. The red boxes say problem. So, square that, just kind of help us.
The short information that's perhaps been maybe a little truncated and people have pulled out is that there's no imminent health risk. That's followed by statements that say there are potential risks to people who already have high sensitivity. And that they list all of those folks who might be included in that. That includes young children, the elderly, people who have allergies, those sorts of existing health concerns. And I would just say that from my layman's understanding, we've had people who have indicated that they no longer are using the library because they've had sensitivity. And most of them have already started using another library, and they don't intend to come back to that library.
So I can comment a little bit on the report. As I read through the report, the story I see, and some of that is supported by some knowledge of what's gone on over the last year. An important piece at the beginning of the report is that the studies that they did of air quality did not include the meeting room, because that's already been sealed off, I think in May? A year ago. So it's already been sealed off because of existing problems that we didn't want to risk exposing others to, or that we didn't want spreading into the main library. So the study is looking at air quality in the existing library, not the meeting room. That's an important piece. The study does say they found no imminent health threats based on the data in the main library. But as you noted from the sampling chart, there are a number of red blocks, as you called them. There's a number of areas where there's high levels. What do the high levels mean? That's really hard to tell. There are no set health standards for mold or bacteria or other particulates in the air, in indoor air. So there's no standard I can compare it to say, oh, it's above this number, so it's a problem. And that's really because when we look at indoor air quality, there could be molds, there could be bacteria, there's dust, there's all types of things that could impact people's health depending on their sensitivity. And then you mix that with humans, and humans have different sensitivities to different things. So as many of you are probably aware, one person can walk into a room and immediately feel impacts from dust or mold or insects or whatever they're allergic to, and someone else could be in that room all day and never feel an impact. So our human systems are quite different. And then the amount of air that we breathe and our current health play a part into that. So all of those factors make it very difficult for scientists to arrive at a standard that they can universally apply for indoor air quality in terms of levels. What we do know is that when mold is present and you can see it, we consider that unhealthy, and we desire from a health perspective for the owner of those facilities to remediate that mold, get it out of there. The mold is just a symptom of a moist environment, a wet environment. The report is very clear that the wet environment continues. And the other key thing about the report that I think is important for everyone to go back and recognize is the conclusion is the building has to be remediated. And they call out a number of areas that require significant remediation. And remediation of mold at that level would require closing of the library. There is no physical way to remediate mold safely while the library is occupied. So that leaves the owners of the building, in this case the county, with a decision: do we close the library and investigate spending whatever that cost on whether or not a major renovation or remediation will solve the problem? Or do we replace the building given its age and given the persistence of the problem over the years? And so that's what the report says to me that I think is important for others to know.
I've had multiple discussions with city officials, and your county administrator never reached out to the city manager of Venice The mayor stated that he found out that this was on the agenda of the county commission the night before the media packets went out. Jeanette Gates found out from our blog that you were even having this today. So I think, what's going on with the communication between the county and the city?
There were conversations between the county administrator and the city manager talking about the issues at the library. We've been sharing data with the city staff for months because they're dealing with similar issues at the Venice Community Center. The decision, the final decision to make a recommendation to the board to close the library permanently, identify a temporary location, and locate a new permanent library, was not made months and months ago. It was made when it became time for us to decide whether we were going to close it to remediate or close it and do what we ultimately chose to do.
But not even a phone call? I mean,
Well, you know, it's not...
should it have hit city officials by surprise if this happened? You have such a major thing in the city, and they find out about it the night before you even discuss it.
I can't speak to, as a fact, who knew what and when, but I can tell you there was communication between county staff and city staff.
And I think going back to the prior remediation in the building in 2012, certainly there was open communication and knowledge between the city and the county, and following that remediation, and then that the existing conditions that led to that had come back. So people were aware that we had a recurring situation. We've had questions and exchanged information. I'd really like to also say that we'll just continue to increase our communication to the community. The folks who are sending emails or making phone calls, we're reaching back out to them and directing them to our website, where there's the fact sheet, there's the FAQ summary, there's the memo that was at that January 12th board meeting, and then also just updates. For example, the community meeting that's coming up next week on Wednesday. So we're really encouraging people to keep an eye on that website. That'll be one of the first places that we'll be able to alert folks to new information.
I think one of the big issues that a lot of the residents have, especially when I was out at the library an hour ago, is that if this issue's been going on for so long, why close the library within 2 weeks of alerting people? Why not keep it open for a little longer if all these people are so attached to the library, while you at least formulate a plan and have more of a seamless transition into a temporary location?
So we can talk about the sequence of events. If you want to start, I'll chime in.
I'll start. As we have repeatedly stated, we've been working on this problem since 2012, this latest issue. And throughout the period of time that this was being investigated, our hope was that we would be able to at some point say, we just need to close for a few days while we do some remediation, or we started looking for sites in April of last year for a temporary closure of the library, thinking, well, okay, it looks like the remediation might be more extensive, so as a backup plan, let's see if we have a place to go to while they close the library for a few weeks and do the remediation. It wasn't until late last year that we were told by our experts and staff that there's no just remediating a part of this. In fact, we don't know what we don't know. We know we have water intrusion. We've run a number of tests to identify where that's coming from. We have not identified a smoking gun. We are sure there's probably, we already know the mold is in the meeting room, but we also know it's showing up elsewhere in this building. The minute we disturb it by opening a wall or removing a ceiling or pulling back the floor, we have no idea what exposure level that will be, and it's a large area. So we're going to be required to close the building to do anything else here. We can't fix it, and we don't know what it'll take to fix it until we close it and basically demolish the interior to find more information out. Well, at that point, we were at a fork in the road. Do we close it with a plan to do a temporary location while we remediate? But then when you ask the experts, how long will that take? We don't know. How much remediation will be needed? We don't know. How much will it cost? We don't know, because we can't tell you till we get in and demolish it. At that point, Sarah Beth and I and others had a conversation about the fact that the library's older. How many renovations?
A total of 8 since the original
Expansion.
8,000 square foot building.
So it was originally 8,000 square feet. 8 times it's been added on to and renovated, which, as all of us know, always creates issues. It's not very functional because it's laid out so poorly from all of the patchwork additions that were done. We want to recommend creating a new library.
But that still doesn't really go around
Okay. I'm
the
getting
answer
there.
of why not have a seamless transition. That's a great way of going around it, but
No, no.
there's no-
I'm getting there.
okay.
So the question then becomes, so when do we close? Now, we've been getting regular indoor air quality reports that all continue to say there's a problem. It's a problem for people who are sensitive, but there's still a problem. We've been getting that report for a period of time. We're all beginning now to get uncomfortable. What happens when the next report says, oh no, now it's not just for those who are sensitive, now it's imminent. When you get that report, you close immediately. No notice, no plan, nothing. So our decision as a team, Sarah Beth had a lot of input in that because of her concern for the patrons and the employees who were in there all day regularly, was we've kept it open. We now know we can't fix it without closing it. Let's go ahead and make a plan to close it. But we won't close it until we have a kiosk ready, so at least people who want to drop off a book or pick up a book don't have to drive to Jacaranda to do that. They can still order their book and pick it up. They can return their books across the street, basically, across the parking lot. So we waited until we knew we could have a kiosk ready, and then that was when the decision was made. And I'll let Sarah Beth take it from there.
Well, and the period of time, we didn't want to delay too long. I mean, we really wanted to go ahead and move forward. But we wanted to let the schools know. We have students, we are very aware. They're walking from school every day. We certainly our close partnership with the Friends of the Library, who operate a used bookstore in the building. And then there was a literacy organization that had a location in our building. We had already relocated them. But still, we wanted to give all of those stakeholders an opportunity to understand that the date is here, and we've given you a little bit of time to make arrangements. The organizations, small organizations now that are meeting at the library similarly, are looking for another place to have their meeting. So all of that was with the best intentions of giving people enough notice, but not delaying the closure.
So is it fair to say that, as you kind of alluded to, that it's not this report right now that is the eminent, we have to close this, but the next one you're saying
Might be.
might be. And at that point,
You
would
have
it be
to
too
close
late? Or,
immediately.
is that fair to say?
So if I could just step in to
Yeah,
answer
sure.
that, from a health and safety perspective, once the data comes together and the decision is either we close and remediate or we close and rebuild, our health and safety recommendation to the county is you should close as soon as possible because we're in the perfect place right now. We don't have health complaints. We don't have a report that says there's an imminent health threat, but we know that mold continues to be a problem. Bacteria, if you looked in that report, because of the damp conditions, continues to be a problem. And those tests from the latest report are all outside of the meeting room where we know the biggest problem is. So our recommendation is you need to do the things you need to do so you don't leave the community in a lurch. but close it as soon as you can for the health and safety of our citizens and for the protection of all of the library books and supplies inside, because they're all fibrous material as well, and the longer they're exposed to damp conditions, the bigger the issue is in terms of cleaning them and moving them. So there's a lot at stake here, especially when you have a facility utilized by people of all ages and all health conditions.
I just want to, it sounds like you just said, while there's no health threat from the current air quality, you would actually recommend to close it now before the next report says that.
We did recommend that they close it as soon as possible.
Okay.
Once they reach that decision point, our recommendation is that they move forward and make that decision for the health and safety of our community.
It's interesting, your question is interesting because we were waiting on the December air quality report, and our hope was that we were going to get the same report we'd gotten the month before. No imminent threat. It's a health risk for people who are elderly, young, have medical issues. We were hoping that's all it would say, so that we didn't have to jettison our plan and close immediately. It came back in December, we all breathed. I mean, we were literally checking our emails, daily. Did the report come back yet? And when we got the report that was basically no imminent threat, but still a health risk, then we were ready to move forward with the plan and announce it.
One question about the air degradation. Was there any kind of a rate to it? Like, was it going up geometrically? Was it just going up mathematically? Or was it just going up or going down, rather?
You're asking me from a health
Yeah.
perspective?
Yeah, from a health perspective.
I don't know that it's changing dramatically. What's significant to me is that we've already had to contain and seal one large portion. They've continued to monitor the air quality in the main library. We see that mold problems persist in the main library, even though they've tried various remediation things. At this point, the recommendation, both from the company that did the report and from health, is that they need to either close and remediate to get rid of it, or close in the direction they're going. But they can't continue because right now is the time to make that decision before we start having health complaints, before it gets to that point where it is truly a health issue for our community.
And let me clarify, when Chuck says before we get health complaints, he means the health department. We have been getting health complaints as the library and the county.
Is there any reason that 2 weeks ago we could have been having this conversation as opposed to now, when we were asking about health and the answer was there's no immediate health?
I'm not sure that was the answer. There's no imminent health risk,
Yeah.
and I believe in Sarah Beth's memo, and
Right.
probably in her presentation on January the 12th, that we said, no imminent health risk at this time, but it is troublesome for people with sensitivities, young people and elderly. So we are recommending to close. And we're further recommending, we're not leaving you in the lurch on, okay, then what? We're recommending to close. We've opened a kiosk for convenience. We're looking for a temporary site, and ultimately, we're going to have a new permit.
I'm thinking earlier this month, when you guys were first talking about it, if you had said, we're closing in part because there's no health threat, but the health department's recommending we close it, that would have been different, because that's what you just said, is that you recommended to close it, and when we went around and around on this, what was the tipping point for when you went from maybe we close it, we work on it, to close it? There was a health department recommendation to close it.
I didn't make that statement, but certainly in the presentation to the board, I know that one of the things that seemed to resonate with them quite strongly was the risk to our employees. We just take that so seriously, in part because we know they're exposed for many, many more hours every day, and it's over a period of time. So, and Chuck's made us aware that there can be a difference in the reaction when people have been exposed for a longer period of time.
And just would want to apologize if the communication has gotten muddled. We've had various venues that we've been trying to get information out as quickly as possible in all sorts of different arenas. And Chuck's been by our side through the whole process. We have a great relationship with the county health department and been giving us advice and working with us, which is basically exactly what he said to us is, if you're not going to close to remediate, when you do make the call, make it sooner rather than later.
I'll return it back to you guys.
So are there any concerns, there are various reports, things out there just questioning the safety of the campus itself, about whether it could be rebuilt there, that there was some kind of contamination problem, and I just want to know where that came from.
We're hearing that too. And before we would consider possibly rebuilding on that site, we would want to know that all these rumors that we're hearing are either validated or not. There's been no decision made on a permanent location, and certainly we believe there will be a constituency that would like us to rebuild right on that site, but that would be a consideration. As to whether there are other, again,
there's
we
nothing
found
that
no
you've seen,
smoking
yeah.
gun.
Yeah, I mean, the county seemed to be really quick about talking about moving it off the island, and maybe we can't rebuild there, and I think that's probably one of the reasons everybody was like, where's this coming from?
No.
So you have no data that suggests there's a problem with the campus itself? Okay.
Other than the water intrusion into the building that continues to cause internal air quality issues.
But contamination or anything, we have no evidence of that, no data that references, at least to our knowledge. So that's not to say that if the community recommends to Sarah Beth and to the county, we want to build on that site, that would, I'm sure, result in a lot more testing.
There's some historical information that we know of. The very last expansion that was conducted at that site. At that time, there was an idea that perhaps the library could become two-story in order to have more space. And the information that the libraries and the architect and the construction folks received in that planning phase was that that site was not appropriate for a two-story building. The expanded part of the library, they drove pilings into the ground to secure the foundation. So that all coming together with the water intrusion that we haven't been able to find the source of would lead to caution to say right now we know or we don't know that we could return a library to that site. And I'll say that I think library staff, including the wonderful staff at the Venice Library, are so very aware of the role that the public library plays in the heart of that community. It's a social gathering place. It's where people rely on being able to come together and find the information they need. So we are very aware of the role that the library plays there.
You actually moved pretty quick. It seems that, the data that the last report is January 6th, and you decided on January 12th, so that's kind of pretty quick movement.
The data that we moved on was a December report.
December, but is that this last report that you have up on your website?
I
think we have.
Yeah, December 23,
Yes.
date of
then.
study, date of report.
I don't know if that's the
January
report,
6th.
but as I mentioned earlier, we had our plan together to execute it so that we would present a recommendation to the board in January. But we were waiting for that December air quality report to come in to make sure we didn't have to move sooner. So,
Guys, any more questions?
Actually, yeah, not so much on, I kind of want to change tack a little bit because I think I'm satisfied with the air. This morning, from what I understand, you guys toured the Hamilton complex. And I imagine you've already taken a look at those other two commercial properties on the list. Is there a possibility there might be a recommendation February 9th for the county commission to pick a temporary location?
Well, we've actually looked at dozens of
Yeah,
locations.
I know, but I'm saying
But in
those are the
narrowing
three
down,
choices.
I can't say for certainty that we'll have a recommendation, but we are very hopeful that we are nearing enough information accumulated to evaluate.
We, of course, our options on the island are limited. Options near the island are limited. So it didn't take long to get to a short list, and the fact that we had started looking back in April, we were actually had a head start. The Hamilton building, would, from a location perspective, would be great, but there's significant renovation involved in use of that building. So we've met with the city staff and are hoping to get, they of course have to speak with their city council about
Yeah.
whether they're interested in the potential, and then they will let us know.
Last question for me, as far as I know. One of the things I've been hearing from a lot of the people that are concerned is the kiosk, yes, you can drop off and pick up books, but there's so many people that rely on the computer access to the library. And from what I've been able to in talking to Drew, it's really just somebody working there, the computer's there for library searches. Will there be any kind of computer access for the general public to use web surfing? Use the web to kind of mollify that problem, or?
The space we're occupying now at the Venice Community Center wouldn't accommodate that. But one of the things that we are certainly encouraging people to do is become familiar with the services here at this library. And we've got planned for moving computer resources, including those that would help people get to the internet, and the self-check machines, all of the technology that's at the current Venice Library. We're hoping we can use that here to handle what will be a bigger volume of business. And the staff here has indicated that there are already a lot of folks who are coming here to visit. We have an open house scheduled on the 6th, so if people haven't had a chance, it's 5.7 miles. I would also recommend that folks in the Nokomis, Laurel, Osprey area check out the historic Spanish Point Library location. And it's got a little different style of library there as well. And then beyond that, Gulfgate and the Northport libraries are the next closest. There's so many things people can also do online. You know, we'll be glad to help folks explore the downloadable resources that we have. That's why that staff person that is going to be at the kiosk is going to be key. It's just, you know, we want that presence. We want people to understand the physical building at 300 South Nokomis may be closing, but we're going to be continuing to provide library services. The person who's there can help people reserve their books, download books, show them the map that gives them directions to the next closest library, answer questions.
Where are the staff going to go for now?
Several of them will be reassigned here, but then we have vacancies around the library system, and certainly we're going to welcome those staff to help us out at other locations.
How many folks do you have?
14 employees. Yes. And so when people visit other libraries, they'll see familiar faces and get to know those folks. They're already acquainted with those folks.
Last question. Have you considered portables on the site? Have you considered the Venice Community Center? I mean, the significance of that to the community is diminished now that there's the Venice Performing Arts Center. I mean, it was needed at one time for the band, the chorale, and the symphony, but now all those musical groups are over at the Venice Performing Arts Center. So is the money that you are getting from renting it to the Chinese dancers and the floral shows, you know, does that make sense if you're having to look at another facility for the library? I mean, is that part of the deliberations?
We have looked at portable modulars and explored that with the complications that would go along with it. What would be an appropriate site and parking. The Venice Community Center is owned by the city, so the organizations that already have reservations there, the events that are planned there, I believe that would be the call of the city to say whether they could possibly consider displacing those folks.
For up to 3 years or more.
Yes, that would, I mean, for a long period of time. We're familiar with their schedule because we have been, from time to time, having some of our events there. And it's a pretty brisk schedule of organizations that rely on that space and events.
Is there anybody being laid off or, kind of furloughed or anything for now?
No,
Everybody's gonna have
No, that was-
jobs moving?
when we had our discussion with staff, that was the first thing we wanted them to understand, is that everybody was going to continue to be employed. We need them. They're excellent employees and we value them.
And the Hamilton condo building, there's a Vabbie building also behind it. Did you tour that? Did you look at that?
We looked at it from the outside,
Right.
noticed that it had a nice meeting room, and there's a playground outside. We did notice those assets.
They just happened to be, the building happened to be closed when we were there, so.
Right. But that is part of the conversation of all the buildings. Okay.
Anything else, guys? I know a few of you want some one-on-one, so we'll make
Yeah.
time for that after with the TV cameras.
Just a reminder about the event.
Please,
On Wednesday
on Wednesday,
evening.
if you would give the details.
So I see this as the first of many community conversations. It's really the beginning of a process that takes place routinely when we plan a new library service. So the community will hear the latest update, the latest information we can provide, a discussion of how we'll begin the participation to plan for a new service. That's at 5:30 at the Venice Elementary cafeteria. And we'll look forward to hearing from folks and also asking them to begin thinking of what they'd like the next library service to include.